What reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare fee-for-service.
And traditional Medicare?
Yes.
That's their choice right now. Well, I mean, we have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 or 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services. But people can't afford it. It's much more expensive. Oh, in answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?